We take between 20 to 30 breaths per minute, nearly 40,000 breaths per day. Our next guest works hard for our lungs when we need it the most. Let's meet a respiratory therapist. Hi, I'm Viviana.
Hi, Ryan. Nice to meet you. Welcome to ICU. My name is Ryan Hughes. I'm a respiratory therapist at St. Paul's Hospital here in Vancouver. Our job is to assist in the diagnosis and treatment of cardiopulmonary problems. Some respiratory therapists work in diagnostics, doing pulmonary function testing and work in a bronchoscopy suite. Some work in critical care, like I do, managing the breathing component of the patient's life support. It's a relatively new profession. And since then, it's evolved to something that's much more clinical. So now we wear stethoscopes. We actually see patients. We are kind of much more a part of the multidisciplinary team. In the morning, we come in at 7 o'clock and we will get handover from the night RTs that we're working. After that, we will go out and we'll actually assess our patients.
What's on your routine today?
Well, every 3 or 4 hours, we go in and we take a look at the patient's ventilator, check their blood work, look at their X-ray, and make any changes on the ventilator that we need to make. Let's go in and actually see this patient.
Okay, sure.
It's important that we organize our day. We're constantly building a workload based on things that need to be done right away, where we have clerical duties and we update our Cardex, which is basically an ongoing history of anything that's happened with the patient. Typically, we work 12-hour shifts. Generally, that's a mix of days and nights, 2 days followed by 2 nights, followed by a number of days off, 4 or 5 days off. There's quite a bit of opportunity for overtime in our department, just depending on the season. I graduated high school and then I did a biology degree at university, and then following that, I went to respiratory therapy school, and respiratory therapy seemed to be a growing field, and it seemed very interesting. It seemed to be a place where the action always was. That's a 3-year program, so the first 2 years is in school, basically bookwork, and then the third year is a full year clinical practicum. You can enter a program from high school. However, the majority of people would have university background.
So Ryan, tell me, where are we? What are we doing?
We're in the ICU right now. This is Jimmy. He actually came in earlier this morning with a flare-up of his emphysema. We're going to start him on some non-invasive ventilation to kind of help his breathing out.
Okay.
So let me just get it fitted here. Okay, head forward for me. And you should notice a difference pretty quickly when this starts working, okay? There's always new equipment, new techniques, new studies coming out that you have to stay on top of. But a lot of it does come down to self-motivated learning, reading. Some people take further education and become cardiovascular perfusionist or anesthesia assistant. There's also business avenues that can be explored. A lot of them are in the sale of nocturnal devices. We have to be really good with our hands, and we have to be able to troubleshoot equipment quickly. We're often called when the alarms start going off, and we run into the room and everybody's panicking, and it's our job to really, really quickly figure out what's going on and reconnect that piece of equipment that became disconnected. We do a lot of communication, obviously. In healthcare, communication is key. We communicate almost continuously with other members of the multidisciplinary team, as well as patients and families. So it's important that we have those social skills. We do a lot of charting, obviously, being in healthcare. So it's important that your handwriting is legible and that you write things in an organized manner. Medical mistakes happen when there's not good communication. So it's something we all try to focus on, is making sure the communications is solid. I think the toughest part of the job is just dealing kind of with the stresses that we deal with on a day-to-day basis. The environment where we work is really full of tragedy, and you really have to figure a way to not take that home with you. I think the most rewarding aspect of the job is knowing that you're instrumental in helping the patient. And it's nice to see patients progress and get healthy, knowing that you're really instrumental in helping to drive that. If you're the type of person who obviously enjoys science, enjoys the idea of a career in healthcare, then the career would be for you.
Ryan, thank you so much. You have a wonderful job here.
Well, I sure had a great time showing you around today. Hopefully you learned something about being an RT.
I sure did.
Perfect.
Once again, I'm Viviana for Career Trek, reminding you that this career could be yours. We'll see you next time.